everybody is obsessed with having a six-pack abs and having those perfect abdominal muscles or abs and show it to the world. But what happens during pregnancy? It is this muscle which gets stretched and it kind of expands with the growing baby and the growing uterus, and then comes a situation that this abdominal muscle, which is say something like this in front of your tummy, it kind of separate out like this. There is a gap between this muscle and it can be seen in the form of a bulge right at the center of your tummy. And this is something that we will discuss in today's video. So let's begin. Hello everyone, welcome back to our channel. In today's video, we will talk about a topic which is called as diastasis recti, and this is a very common problem which is seen after delivery or in the postpartum phase by many women. And the statistics say that around 40% of women, they do suffer from this condition, and majority of them do not know what to do or it even exists for them. So let us talk about this and see what all can be done to treat this condition. This muscle, which is placed in front of your abdomen, you can say it expands as well along with your baby and your tummy. So what happens in some women, there is a chance that this thing can open up. This muscle, rectus abdominis muscle, is connected in the center by a connective tissue which is called as linea alba. Now what happens during pregnancy, there is a release of certain hormones like relaxin, and with the increasing in the size of the uterus and the baby, this thing gets stretched. The connective tissue which is connecting these two muscle parts of rectus abdominis in front of your tummy, it gets stretched. So if there is a separation between your rectus abdominis muscle, or if there is a gap or a space between your abdominal muscles, that is called as diastasis recti. This separation can be seen at the level of your belly button. It can be little above your belly button area, or it can be little below that level. And the separation needs to be of around 1.5 to 2 centimeters deep. That is, when done on proper assessment, that should be the gap between these two muscles. If it is of that much amount, then it is confirmed that the person is having diastasis recti problem. And yes, around 40% of women during pregnancy or after delivery experience this. Now it is very evident that why this happens during pregnancy, because it is the pregnancy phase and various hormones are working and the baby is increasing in size and everything is kind of pushing your abdominal wall outside. And if there is weakness already present in your abdominal wall, then there is a high chance that the muscles will separate at the center, and then there is a gap that is developed which needs to be corrected somehow so that it do not rupture properly. Like if the mother is having more age, or if there is advanced maternal age, if the baby's size is very large, or if somebody is having twins or multiple gestations as we call it, and if women are having their second or third pregnancy, because with subsequent pregnancies the strength of the abdominal muscles, they keep on decreasing. So if these are the factors, then yes, they are considered as the risk factors for development of this condition.
Now how can you assess it? Well, ideally you should consult your gynae, your doctor, or your physical therapist who's going to do it for you. But if you want to have a quick idea, you need to lie down on your back like this, and your knee should be folded, and you need to concentrate on your abdominal area, especially near the umbilicus, little above and below it as well. So concentrate on your abdominal area, be relaxed, and very slightly raise your head up from the bed, very gently. When you do that, you look for any kind of separation between your abdominal muscles. For this, you will need 2 or 3 fingers like this, and then place them not vertically like this but horizontally in this manner. And then you look out for any kind of depression or any gap if you can feel between the two muscles of the rectus abdominis. If you feel your fingers are going deep and you feel there is a separation there at any level, then it can help you in diagnosing this condition. But again, always do get it cross-checked and confirmed and properly assessed with a physical therapist.
Now, how you can avoid this condition? You do not have to do any activity that leads to bulging of your abdominal area, or which requires excessive straining to the abdominal area. So anything like crunches or lifting heavy stuff or doing sit-ups, these kind of exercises and these kind of activities needs to be avoided. Also, coughing and straining while passing stool is also needs to be done carefully while you are supporting your abdomen area, either with your hands properly wrapped around it or with the help of a belt. Now, is there any exercise that you can do to prevent this condition from occurring, or if it has already occurred, what you can do to correct this as well? Now, let's quickly look at one exercise which will immensely help you if you want to avoid this condition and prevent it from happening. Now, for this, you have to be lying on your back and your knees will be bent. Now, very gently and slowly tighten your abdominal muscles and now press them towards your spine. So that means if you are in lying position, then you will be pressing it towards your spine, so it will be towards the ground or in the downward direction. And then progress very gradually. Once you are able to tighten your abdominal muscle, hold it there for some time. It can begin with 4 to 5 seconds initially and then relax gently. Even the relaxation phase should not be very quickly done. It should be very slowly that you release your muscle, and it should be very slowly that you increase the gain in the contraction of the muscle. Now, as you are able to do this properly, then you can now you should aim for at least 10 seconds of holding or contraction, and try to do this for about 10 repetitions. And if you can do this exercise twice daily, it will be much better. Apart from this exercise, the basic pelvic exercises and the Kegels exercise, about which we have talked so many times in our previous videos, are also very helpful. So do add these two as well in your exercise routine if you want to prevent this condition. So that's it in today's video. If you like our content, then please like it, share it with someone who might find this video useful, and don't forget to subscribe to our channel to support us. Till then, be happy, be safe, and we'll see you soon in our next video.